Welcome back. Joining me now are doctors David Pryor and Anezi Uzendu, and we are going to talk about CPR today, and obviously that's a very important topic. Thank you for being here this morning.
Thank you. That's right.
Yeah, and so let's talk about it a little bit. Obviously, let's talk about CPR, but what you're saying is that people are maybe a little bit hesitant to learn about CPR or jump in to give somebody CPR. Let's talk about that hesitancy a little bit.
Yeah, sure. There was a recent survey conducted by the American Heart Association. It was funded by the Anthem Foundation. And this survey found that 6 out of 10 people still hesitant when they're asked, if you found somebody down unresponsive, would you perform CPR? And so the biggest reason why people are hesitant is still a lack of knowledge, lack of training. And so we're really here today during National CPR Week to say, this new technique of hands-only CPR is really not all that difficult, that it's easy to learn, and it really can make a difference in saving someone's life. Really the technique has been simplified. It really is, calling 911 first, of course, and then applying these firm, rapid chest compressions until emergency help arrives. So really excited to be here today.
Well, I think that's so important to stress that it is really so much simpler than it used to be. And so the training obviously is simple and more simple as well. And so, but you, Dr. Uzendu, have really firsthand knowledge of needing this type of training and being the recipient of it because you have recently experienced a cardiac arrest. So tell us about your experience.
Yeah. So at the age of 25, I had a cardiac arrest playing basketball. And you kind of think of people that have heart disease. You wouldn't think of a healthy, athletic 25-year-old that had really never been sick in his whole life. But that's what happened to me. And, 350,000 people have a cardiac arrest every year, which comes up to be about 1,000 a day. And I ended up being one of those people. I'm so grateful that people there weren't hesitant and they knew the steps in bystander CPR. They called 911 and they pushed hard and fast on the chest. Like we said, the 2 steps of hands-only CPR. There was also a defibrillator available, which can shock the heart back into normal rhythm, and they used that. And then the EMS providers came. They took me to the hospital. I was still very sick for a while, but I was able to make a recovery and go back to finishing my training and becoming an interventional cardiologist, going back to my family. And so that's the reason why we're here today, to make sure that other people get the chance to go back to their families, go back to their lives by creating a community of resuscitators, community of heroes, lifesavers that know the steps to perform CPR and save a life.
Absolutely. Well, so glad you're here talking with us about this today and that you have recovered fully. Let's talk a little bit about how somebody does go about getting the training that they would need to know how to do the 2-hand compression CPR.
Yeah, so the website we'd refer you to is heart.org/hands-only CPR. There are videos and other resources to be able to become familiar with hands-only CPR. You can also reach out to your local AHA office. There are other organizations as well that offer CPR training, but a good place to start again is heart.org/hands-only CPR. You can learn that skill set. And again, save lives. We know that most people that have a cardiac arrest actually don't receive CPR. Only about 30 to 40% of people receive CPR, even though cardiac arrests mainly happen at home. So the people that are around are the people that love the person the most and that are most motivated to help save a life, but we haven't really equipped them to do so. And so the point of this week is really making sure we're equipping our communities, equipping our families to save the lives of their loved ones.
Yeah, for sure. And we have about a minute left. I know you touched on the defibrillator. Is that something that a layperson can just really grab and use, or do you need to be trained in that as well?
No, that does not require training. You can obviously get training, and again, there's those resources available, but the great thing about AEDs is all you have to do is turn it on. There are so many different brands, so many different types, but all of them function the same. You turn it on and it'll actually tell you what to do. So don't be afraid. If there's someone around that's available to grab one and there's a signage for one, go get it, turn it on, and it'll tell you how to apply it and use it appropriately.
Well, thank you so much for being here, doctors. We really appreciate the information, and make sure you're getting out there and getting yourself trained so that you can help save a life.
Thank you.
Thank you.
Much more to come. Don't go away.